We are into chapter 25 now for comfort, rest, and sleep. We all know how important this is for any age group. We are going to go ahead and skip over the contents. You have them right there. We're going into comfort, rest, and sleep are needed for well-being. A total person is affected by comfort, rest, and sleep problems. Discomfort and pain can be physical and or emotional. Rest and sleep restore energy and well-being. Illness and injury increases the need for rest and sleep. Comfort is a state of well-being. The person has no physical or emotional pain. The person is calm and at peace. OBRA and CMS require care that promotes well-being. Comfort, rest, and sleep are needed for well-being. Rooms are designed and equipped for comfort. Whenever the cause of discomfort or pain that affect rest, sleep, and decrease function and quality of life, the body needs more energy for healing and repair. Age, illness, and activity affect comfort. So do temperature, ventilation, noise, odors, and lighting. Such factors are controlled to meet the person's needs. Please review Focus on Communication Comfort in the textbook. OBRA requirements. These OBRA room requirements promote comfort. No more than 4 persons in a room. A suspended curtain that goes around the bed for privacy. They require a bed of proper height and size for the person. A clean and comfortable mattress. Linen sheets, blankets, spreads that's suited for weather and climate. A clean and orderly room. An odor-free room. A room temperature between 71 and 81. Remember that. An acceptable noise level, adequate comfort bed. All of these are very important. Pain or discomfort means to ache, hurt, or be sore. Comfort and discomfort are subjective. You must rely on what the person says. If a person complains of pain or discomfort, that person has pain or discomfort. Pain differs for each person. Pain is having a warning from the body. You cannot see, hear, or touch or smell pain or discomfort. You must rely on what the person says. Report complaints to the nurse for nursing process. Review the Focus on Communication Pain in the textbook. And pain signals tissue damage. Pain often causes the person to seek health care. There are different types of pain. Acute pain is felt suddenly from injury, disease, trauma, or surgery. It usually lasts less than 6 months. Chronic pain lasts longer than 6 months. There is no longer tissue damage. Radiating pain is felt at the site of tissue damage and in nearby areas. Phantom pain is felt in the body part that is no longer there. It's like when a person has a leg amputated, foot is amputated, or the hand is amputated. They feel pain in that hand, but it's not there. That is phantom pain. The hand is not there. So also acute pain may signal a new injury or life-threatening event. There is tissue damage. Acute pain lasts a short time. It lessens the healing. Chronic pain, persistent pain remains long after healing. Arthritis is a common cause. An example of radiating pain is pain from a heart attack, which is often felt in the left chest, left jaw, shoulder, or left arm. Gallbladder tissue can cause pain in the right upper abdomen, the back, and the right shoulder. A person with an amputated leg may experience phantom pain. Radiation pain, this is of a gallbladder pain, may radiate to the right upper abdomen, the back, and the right shoulder. see that going up and then going to the right shoulder, going down and down to the back. Factors affecting pain. Past experience. Pain can cause anxiety. Anxiety increases how much pain the person feels. Rest and sleep. Attention. The more a person thinks about the pain, the worse it seems. Personal and injuries. The value or meaning of a pain. Support from others. Cultural illness. Age. Persons with dementia may not be able to tell you about their pain. Or people who can't communicate. Report any changes in a person's usual behavior to the nurse. And that's usually an indication that maybe someone is in pain. To some people, pain is a sign of weakness. Dealing with pain is often easier with family and friends offer comfort and support. Facing pain alone is hard for everyone, especially children and older persons. In some cultures, the person in pain is stoic. The OBRA, the Omnibus Budget Reconciliation Act, requires that the care planning process reflect person's culture. Some diseases cause decreased pain sensation. Older persons may have decreased pain sensations, and the person is at risk for undetected injury or disease when it's like that. Thinking and reasoning are affected in some older persons. Increased confusion, grimacing, and restlessness may signal pain, so may changes in usual behavior. You must be alert for the signs of pain. Always report changes in the person's behavior. Pain assessment. The nurse needs this information to assess the person's pain. Location and any radiation. Onset, when did it start and how long? Intensity, rate from 1 to 10. Description, factors causing pain, precipitating factors. Factors affecting pain, better and worse. Vital signs, other signs and symptoms. All of this is important. Again, you cannot see, hear, feel, or smell a person's pain. You must rely on what that person tells you. And ask the person to point to the area of the pain. Is the pain mild, moderate, severe? Is it radiating? Is it stabbing? Ask the person to rate the pain on a 0 to 10 scale, or the Walt Baker Faces pain rating scale. If the person cannot describe the pain, offer words listed in box 25 in the textbook. This is the Walt Baker Faces pain rating scale. As you can see, 0 means no pain, and go all the way across. Now, everyone also, remember, experience pain in different ways. Some people might not even show their pain, and they are in severe pain, but they have learned how to tolerate it maybe, or just have high tolerance of pain. And there's low tolerance of pain for individuals. So you just have to know that. Nursing measures to promote comfort. The nurse uses the nursing process to promote comfort and relieve pain. Distraction means to change the person's center of attention. Relaxation means to be free from mental and physical stress. Guided imagery is creating and focusing on an image. Doctors often order drugs to control or relieve pain. The nurse uses the nursing process to promote comfort and relieve pain. The care plan may include the measures to promote comfort and relieve pain. Review box 23.3 and figure 25.5 from the textbook. Drugs to control or relieve pain can cause orthostatic hypotension. See chapter 24. Drowsiness, dizziness, and coordination problems. Protect the person from injury, falls, and fractures. The nurse and care plan alter you to needed safety measures. Nursing measures, other therapy measures, transcutaneous electrical nerve stimulations, just shorten it as TENS. ice and heat application are often effective. Ultrasound therapy transmits sound waves. Exercise and massage therapy may also be used. The nurse uses the nursing process to promote comfort and relieve pain. TENS may be ordered by the doctor for this therapy. Electrodes are placed on the skin near the painful area, and they are connected to a device that sends electrical impulses that block pain signals. Measures implemented to relieve pain. There are sometimes to keep a person's position in good alignment with pillows used for comfort. The room is darkened. Blankets provide for warmth. On the right side, a comforting pet can distract attention away from your pain. There's the TENS. You put it where the pain is located. And also a good comfortable chair. That doesn't look that comfortable, but it might be. The resident reads cards and letters from families and friends, and that can be comforting also. Promoting rest, meeting physical needs, meeting thirst, hunger, and elimination needs, assisting the person to a comfortable position in good alignment, providing a quiet setting, providing a clean, dry, and wrinkle-free bed, providing a clean, neat, and uncluttered room is also important. Love and belonging promote rest. Self-esteem needs relate to feeling good about oneself. The amount of rest varies from each person. Healthcare routines usually allow time for afternoon rest. Ill or injured persons need to rest more often. Plan and organize care to allow uninterrupted rest. Meeting physical needs and just making sure that everything is nice in the room, quiet and comfortable. Meeting safety and security needs, keeping the call light within reach, explaining the reasons for care, explaining how care is given, following the person's routine and rituals whenever possible, promoting love and belonging needs, visits and calls from family and friends, reading cards and letters, and please make sure you give the messages to the family when a relative or friend call. It's not good to follow up. You say yes and don't do it. Promoting self-esteem needs allow personal choice in sleepwear, assisting with hygiene and grooming as needed. Sleep is a state of unconsciousness, reduced voluntary muscle activity, and lowered metabolism. Metabolism is the burning of food to produce energy for the body. Love and belongings promote rest. Self-esteem needs relate to feeling good about yourself. The amount of rest varies from each person. Healthcare routines usually allow time for afternoon rest. Ill and injured persons need to rest more often. Plan and organize care to allow uninterrupted rest. Sleep, a basic need, it lets the mind and body rest. The body saves energy. Body functions slow. Vital signs are lower than when awake. Tissue healing and repair occur. Sleep lowers stress, tension, and anxiety. It refreshes and renews. Circadian rhythm. Circadian rhythm is a daily rhythm based on a 24-hour cycle. Circadian rhythm includes a sleep-wake cycle. Healthcare often interferes with a person's circadian rhythm and the sleep-wake cycle. There are two phases of sleep. You have the NREM sleep. Non-REM sleep is the phase of sleep in which there is no rapid eye movement. The rapid eye movement phase is called the REM sleep. Sleep factors are, let me go back to the non-REM sleep. It has 4 stages. Sleep goes from light to deep as the person moves through the 4 stages. In REM sleep, the person is hard to arouse. Mental restoration occurs. There are usually 4 to 6 cycles of non-REM and REM sleep, during 7 to 8 hours of sleep. Stage 1 of non-REM is usually not repeated. Enuresis, urinary incontinence in bed at night may occur during non-REM sleep. Review box 25. Sleep factors. Sleep needs vary from each age group. The amount needed decreases with age. Factors affecting sleep: illness, nutrition, exercise, environment, drug and other substance, lifestyle changes, emotional problems, and sleep disorders. Sleep disorders involve repeated sleep problems. The amount and quality of sleep are affected. Quality relates to how well the person slept and involves getting needed amount of non-REM and REM sleep. Also, insomnia is a chronic condition in which the person cannot sleep or stay asleep all night. There are 3 forms of insomnia: cannot fall asleep, cannot stay asleep, awakens early, and cannot fall back to sleep. With sleep deprivation, the amount and quality of sleep are decreased. Emotional problems are common causes of insomnia. The nurse plans measures to promote sleep. However, the emotional and physical problems causing the insomnia also are treated. Illness, pain, and hospital care are often causes of sleep deprivations. Sleepwalking. The person leaves the bed and walks around. The person is not aware of sleepwalking. The event may last 3 to 4 minutes or longer. You need to protect the person from injury and falling. Guide the person back to bed and awaken the person gently. Stress, fatigue, and some drugs are common causes of sleepwalking. Guide sleepwalkers back to bed. Review teamwork and time management. Sleepwalking in the textbook. Sleep apnea. When a person has sleep apnea, he or she may stop breathing for short periods of time throughout the night. Sleep apnea may have different causes. Some people don't know they have sleep apnea. They may report being sleepy and tired during the day. One way to treat sleep apnea is with CPAP, a continuous positive air pressure. A sleep study is performed to observe the person while he or she is sleeping. A doctor orders CPAP. The person wears the CPAP, a continuous positive airway pressure mask, while sleeping. The mask forms a tight seal over the person's nose, the nose and mouth. A tube connects the mask to the machine that keeps the air flowing through the person's airway. Some people can apply their own CPAP at night. Others may need assistance. Always report to the nurse if the person takes off the mask or refuses to wear it. Promoting sleep. The nurse assesses the person's sleep patterns. Measures are planned to promote sleep. Follow the care plan. Report your observations about how the person slept. The person is involved in the planning care also. In persons with Alzheimer's disease and other dementias, night wandering is common. Restlessness and confusion often increase at night. Rituals and routines before bedtime are allowed if safe. Review residents with dementia promoting sleep in the textbook. Quality of life. Comfort, rest, and sleep are needed for quality of life and well-being. Oberon and SMS have requirements that promote comfort, rest, and sleep. The right to personal choice and taking part in the care planning promote comfort, rest, and sleep. Residents have the right to have pain assessed and managed. Comfort involves more than physical needs alone. Emotional, spiritual, and social needs must also be met. Time spent with friends and family provides comfort for residents. For some, religious ceremonies or rituals promote peace and healing. Allow time and privacy for these events for the needs. Untreated pain decreases quality of life. You must report signs and symptoms of pain. This helps the nurse meet the person's needs. This is the end of the comfort, rest, and sleep.